Hey guys, welcome back to another session of Unacademy Future Doctors here on this channel. I'll just check if the live stream has started and if I'm visible and audible to everyone. Just give me a minute or two to check if the live stream has started. You can let me know in the chat section if I'm visible and audible to everyone. Just a second. Uh, is the live stream running all right? Because I cannot see it. I'm not sure if the live stream is running all right or not. Am I visible and audible to everyone? Just give me a minute to check. The stream is running okay. So, I just concluded a session on clinical applications, and this one is another session on image of the day. Okay, so one session on image of the day I've already taken. Not just one session, few sessions more. One session in this month I have taken. In the previous months also I have taken a lot of image of the day, mnemonics of the day sessions, right, which have been liked by most of you. So I'm here with another such session, and I hope you guys like this session. But let me just check if it is running smoothly or not. Okay. If everything is all right, then only we can resume. Okay. Yeah. Okay then. So I'm your educator for biochemistry. I'm Dr. Shivangi Shukla, and we have one. So today I have one question for you, and after this, I'll be giving you 5 minutes to answer the question. And after the time is over, according to your answers, and I'll discuss the answer with you, and then I'll discuss the theory behind that. Okay, so do let me know in the chat section what your answers are. Okay, all of you should answer. There should not be any apprehension regarding answering wrongly. It is okay even if you get the answer wrong. You should just get into the habit of answering, of attempting questions, as many questions as possible. Now, I'll just quickly brief you about the different types of subscriptions for NEET PG that are available on the Unacademy app. As the NEET PG examination is round the corner, it is very pertinent for all of you to ace up your preparation. Okay, and we the educators at Unacademy are here to help you in every step of your way through doubt solving sessions, one-to-one open house audio mentoring sessions, a lot of classes, a lot of quizzes, question banks, PDF notes. All of these are available in both Plus as well as Iconic subscriptions. The Iconic subscription will also, in addition, provide you with resources from Prep Ladder as well. Okay, and what is the one big USP of both of these subscriptions is that while providing you with a simulated classroom feel, a simulation of a classroom environment through various state-of-the-art features like raise your hand, polls, and various interactive sessions like open house sessions, which is a very novel and commendable effort by Unacademy. Open house one-to-one audio sessions. So while providing you with a simulated classroom environment, it ensures that it leaves you with the option of attending the class at the at your own free will, and at your from the device of your own choice, even at the comfort of your home. Okay, so this is, I think, it could not get better than this. Okay, now as I was saying, the NEET PG exam is just round the corner, so it is very pertinent for all of you to be to subscribe to this, because what we have here on Unacademy is that there is a revision batch from March 16th to May 16th. Okay, just in 2 months, you will be covering the entire subject through revision, very fast revision, the entire syllabus of medical science, all the 19 subjects, and there'll be 40 plus educators in one batch. Okay, covering 2 months. There'll be 8 grand tests and 19 subject-wise tests for each subject. Okay, and there is this well-defined structure for this revision batch. That is because for any reading, for any sort of preparation, you need to have a structure. For your preparation, for answering, for revision, you need to have a structure. Now, so these classes are this batch involves revision classes, self-study, tests, and discussion of the solution of the test. Okay, so it is very very important for you guys to subscribe for these 2 months for this revision batch. It is very very important, guys. Okay. And so these are the prices, and for availing 10% discount, do not forget to put in the educator code DRSHUKLA, Dr. Shukla. This is the code that is going to fetch you 10% discount, 10 whole percent discount, guys. 10% discount on both Iconic and Plus. This coupon code DRSHUKLA, Dr. Shukla. So please do avail of it, guys. I cannot stress its importance enough in these times. Okay, when the NEET PG exam is just round the corner. So having said that, this is the image for the day. It is a pedigree chart. You have to look at it. I'll give you sufficient time. I'll give you 5 minutes to look at it, understand this, and decipher the mode of inheritance. This is a very commonly asked question in entrance exams, both PMTs and PG entrance examinations, and also in professional examinations. Also during Vivas, you get a card. You get those card tests. You get those table Vivas during stages. The table Vivas you get. There you will be given these pedigree charts. Okay, so very very important for you to understand, to know what these pedigree charts mean. Okay, now, what is the mode of inheritance depicted in this pedigree chart? Your 5 minutes will start now. All right, after 5 minutes, within these 5 minutes, I want the answer in the comment section, and everyone has to answer. No one will shy away. No one in this class shies away. Okay, we make mistakes, we goof up, but then that is how we get prepared to answer, to show our best, to depict our best at the time of the examination, on the day of the examination. Okay, so you can goof up as much as you want to right now during preparation, but I will ensure that you guys show your best on the day of the examination. So no hesitation, no shyness. You have to answer here. Okay, no one is judging us here. Your time has started. 5 minutes for you to answer. Okay, the mode of inheritance depicted in this pedigree chart. Come on, all of you have to answer. Come on, guys. I should see answers trickling in the comment section. Come on, guys. Time is running out. You guys should know how to decipher these pedigree charts. Very, very important. You should be thorough with how to decipher the pedigree charts and how to draw the pedigree charts for different types of inheritance. Okay, or for any disease. So you should know that the modes of inheritance for common diseases. Now this is how the pedigree analysis differs as you mature or as you go on further in your, as you graduate or as you become senior, increase in seniority. What happens is now during PMT you will be asked with autosomal recessive. Say you'll have to draw a pedigree chart for autosomal recessive inheritance. Then what will happen in your PG entrances? You will be given a particular disease that is inherited through autosomal recessive inheritance. Suppose the most common one which we just read in the last session, that is Hartnupp's disease, that is inherited through autosomal recessive inheritance. So you will be asked to draw the inheritance pattern of Hartnupp's disease. Okay, so this is how the thing differs. You should but you should first of all, the basic is you should know how to draw the pedigree chart. Different symbols, all these things you should know, which you have read in before PMT only in 11th and 12th. But still, you should know how to do that. Also, you should know the modes of inheritance of common disease. Okay, and all right. So, okay, try and decipher what this pedigree chart means and answer in the comment section. Come on, I want answers from each one of you. No shying away from answering. No one shies away. You have to answer in the comment section. Come on, guys. This is how you will practice. This is how you will know. Because if you don't venture with an answer, if you just keep the answer to yourself, you will not be confident. Venture with the answer. Venture out. Do not be scared. Do not be apprehensive. What is the maximum that you will do? You will get the answer wrong. That's it. But if you do not get into the habit of answering, if you do not get into the habit of clearing your doubts here, then the maximum that will go wrong will be a huge loss, and that will be you can lose getting a seat in your entrances. Okay, so getting things wrong during the entrances is far more riskier. It's far riskier than getting it wrong here. Here, if you get the answer wrong, there is no loss. But if you get the answer wrong at the during the day of examination, then it will be losing out on the whole year. Okay, keep that in mind and answer, guys. Last 2 minutes left. Last 2 minutes left for you guys to answer. Come on, come on. Do it, all of you. Last 1 minute left, guys. Come on. Okay, so I think I'll last 10 seconds and then I'll be out with the answer. Okay. So what is the answer? The answer, as many of you would have guessed, is the answer is mitochondrial in. What is it? It is mitochondrial inheritance. Now, what is mitochondrial inheritance? Mitochondrial inheritance is inheriting uh, qualities or inheriting characteristics through the mitochondria. Mitochondrial DNA. Now, mitochondria also contains DNA. Mitochondria, which is what? In common parlance, it is a topic of jokes as well. Powerhouse of the cell. Okay. Mitochondria is the powerhouse of the cell. Now, this mitochondria also contains DNA just like the nucleus. Okay, it contains the DNA. It contains DNA just like nucleus, just like the nucleus. Now, this mitochondrial DNA is transmitted from the parents to the offspring only through the mother. Only through the mother. Why? Why is it so? Why? Because so this is the ovum and this is the sperm. Okay. Now, this is the tail. This is the body which contains the mitochondria. Spirally arranged mitochondria is present in the sperm, isn't it? All this we have learned. This is the acrosome of the sperm. What does acrosome do? It helps in penetration of the ovum, zona pellucida. Okay, and this is the body containing the mitochondria. Spirally arranged mitochondria in the body. This is the tail. What is this? This one is the tail. Okay, now this helps in movement or swimming of the sperm in the vaginal fluid and okay and through the uterus into the fallopian tube. Okay, now what happens is this mitochondria provides the energy for the sperm to reach the ovum. Okay, now this is the ovum. This is the structure of the ovum, granulosa cells, zona pellucida, and the like. Now, once it penetrates inside the mitochondria, most of the mitochondria is left behind. Okay, and the little mitochondria from the sperm that enters the ovum, the little bit of mitochondria from the sperm that enters the ovum is destroyed. Okay, so the mitochondria present in the ovum, the mitochondria present inside the ovum, this is the mitochondria that is finally present in the zygote. So this is the zygote, one-celled zygote if you may. This is the nucleus, this is the mitochondria, and this mitochondria is from where? This is this one. This is the maternal mitochondria. Because the mitochondria of the sperm, it does not enter the ovum and the little bit that enters, that is destroyed. Okay. So, any disease that is carried in the mitochondrial DNA will be transmitted only from the mother to the child. any male containing any mitochondrial disease cannot transfer it in his progeny. Okay, that male will only be the bearer of the symptoms of the disease, but he cannot transmit it to the offspring. Okay, because the mitochondrial DNA is not transmitted from the sperm. The mitochondrial DNA is not, mitochondrial diseases are not transferred from the male uh, parent. Okay, so that is the most important characteristic. And have you understood why? So the first important characteristic of mitochondrial diseases are that are carried through the DNA present in the mitochondria. So first important characteristics we'll write: transmitted through the DNA present in the mitochondria. Okay. Now second, the mitochondria are not transmitted or inherited in the zygote from the paternal the DNA, mitochondrial DNA the mitochondrial DNA is not inherited in the zygote. The mitochondrial DNA is not transmitted or inherited in the zygote from the paternal mitochondria. Okay. Next, the mitochondrial DNA in the zygote is all inherited only from the female mitochondria. So what does it conclude? It means that the mitochondrial DNA, the mitochondrial diseases are inherited only from the maternal parent. Therefore, a male suffering from a mitochondrial disease cannot transmit it to its progeny. Okay, next, a female suffering from a mitochondrial disease will transmit it to its progeny. Understood? Through maternal inheritance. Okay, understood? Now, what is the applied aspect? The applied aspect is a three parent baby. Have you heard of a 3-parent baby? Hi, Vinod Kumar. Hi, how are you? Have you heard of a 3-parent baby? Anyone? This is an applied concept of mitochondrial inheritance. Now, suppose a male and a female, now they marry, okay? Now they find out through genetic studies, preconceptional studies, that the female is suffering from mitochondrial inheritance disease. Okay. Now they have to have a child. Now they know that the female is going to the mitochondria present in the zygote is all of it is coming from the female only. So all their children are going to suffer from mitochondrial inheritance disease. Now what will they do? Okay, there is a concept of 3-parent baby where the mitochondria present in the ovum of this female, the mitochondria is removed. The mitochondria is removed. Okay, and what happens? Sorry, the nucleus, not the mitochondria, the nucleus present in the ovum is removed from this female. Okay, the nucleus present in the ovum of this female is removed, and where is it inserted? That nucleus is inserted in the ovum of a healthy female. This is a healthy female, so the nucleus will be removed from here and will be inserted in the ovum of a healthy female. And now that ovum carrying the genetic information of this female only, but the mitochondria of this female, that ovum is going to be fertilized with the sperm of this male. So essentially, the ovum will contain the genetic information of this female only, and the sperm, and so the ovum will be fertilized. The nuclei that will contain the basic genetic information, the nuclei will be from this married couple only, but one healthy ovum containing the mitochondria, the healthy mitochondria. So the diseased mitochondria is removed, and the nuclei containing the important genetic information and the characteristics, that is retained. So understood. So this 3-parent baby means the nuclei of the parents and the mitochondria of a healthy donor female. Understood? So this 3-parent baby is an applied concept of mitochondrial inheritance. Now let us go back to the pedigree and analyze this pedigree before we end this. What is this? This is a male marrying a female. This female is diseased. We don't know yet what disease. Okay, so we know that this female is diseased. Now, all their offsprings, irrespective of their gender or their sex, they are affected. So this is not sex linked. This we have eliminated. It is not neither X nor Y linked, because all the sexes are affected. Okay. It can either be autosomal inheritance, or the other type of inheritance is maternal inheritance. Okay. Now you see, had it been autosomal inheritance, then these children, either both or one should be affected. Here also they should be affected, but they are not affected. So sons are not transmitting the diseases. Males are not transmitting the disease, but the females again are transmitting the disease to all the offsprings. This is consistent with what type of inheritance? Maternal inheritance. And maternal inheritance is for what? Mitochondrial diseases. Now quickly we'll discuss the examples of a few mitochondrial diseases. Anyone? Can you guys tell me in the comment section the examples of mitochondrial diseases? Can you guys tell me what are the examples of a few examples of mitochondrial diseases you should be thorough with? You should know once, whenever anyone asks you of mitochondrial diseases, you should know. One is Leigh syndrome, very, very important. Okay, it is a neurological disorder which leads to early death. Okay, respiratory failure and early death. Leigh syndrome, then MELAS. MELAS is what? Mitochondrial encephalopathy, lactic acidosis, and stroke-like symptoms. MELAS. Okay, it is an acronym. Then MRF. MRF is myoclonic epilepsy and ragged red fibers. Okay, so these three are very important mitochondrial inheritance diseases. Okay, understood this? So I think this will be it for this session. If you guys have any doubt, you can ask me in the comment section. I'll be available for the next 1 minute, and then we can conclude the session. Okay, guys. If you haven't subscribed to this channel, then do subscribe to it. Follow me on the Unacademy app. Go there. The link is provided here for my profile on the Unacademy app. Go there and you can follow me there for timely updates for Unacademy special classes. I take a lot of MCQ sessions, revision sessions, theory sessions there. According to your demand, whatever you guys demand, whatever you guys wish to be taken up, I take up there. And you can subscribe to this channel to be reminded of to be notified of you get timely notifications at least 1 day prior to when the classes are scheduled. Okay, I have another session at 10 p.m. tonight where I'll be discussing strategy for revision of strategy for resuming studies after a gap. Okay, at 10 p.m. So just after you finish dinner, you can start watching that session. You can tune in to that session. Okay. If there's any doubt, then you can ask me here. Otherwise, I'll conclude the session. All right. I hope all of you have understood and you guys will practice more of these pedigrees, pedigree analysis. Very, very important. Okay. The session is open for any discussion, any doubts that you guys have for this session or for any other academic or any other preparation related doubts if you have. Which reminds me that Unacademy has come up with open house sessions, which are 1:1 audio discussion sessions between the educators and the learners. Okay, so if I schedule an open house session, it will be regarding some particular topic. Say if I schedule a session titled Ask Me Anything. So there you guys can ask me anything, any doubt regarding your preparation. Be it academic doubts, strategy related doubts, any other difficulties that you're facing. Suppose if many of you have doubts regarding genetic inheritance or inheritance patterns like these, then I can take up an open house session on inheritance patterns. There I'll be giving you tips, I'll be discussing, and that session will be open for audio 1:1 discussion with any of you. All those who have entered the panel, who have entered the session. Okay. So it will be like talking over phone to your mentor. Okay. So any number of doubts for whatever till the time the session is in progress, you can ask the doubts. Okay, so it is and also your privacy is maintained because it is not a video session. So you guys people are really enjoying that. People are really benefiting from that. And I would advise you guys to try it out, the open house sessions. All right. Now, since I'm not getting any doubts here, I think I'll conclude the session and let us meet at 10 p.m. tonight. Okay. All right, guys. Bye-bye. See you.